APIA Nevada is a grassroots nonprofit organization that advocates for policies empowering everyday Asian Pacific Islander Nevadans. Nevada is home to a growing APIA community, accounting for 1 in 10 voters. We are One APIA Nevada. Tonight's episode of Out in Front is brought to you by our season sponsors, Nevada State Education Association, One APIA Nevada, Silver State Voices, and Stefan and Marta Schmidt.
Good evening, everybody, and welcome to Out in Front with Battleborn Progress. My name is Will Pregman. I'm the Communications Director here at Battleborn Progress, filling in for Annette Magnus tonight. I am so excited to have our panel discussion this evening. We just crossed a major legislative deadline here in Nevada, but there's also a lot of federal stuff happening too around the debt ceiling and the budget. We're going to be talking about all of that right here tonight. So please, if you're enjoying our discussion, share with your friends, add questions to the chat, and get to know our awesome guests we have with us this evening. I'm so excited to be joined here with Assemblywoman Venicia Considine of Las Vegas, who's joining us tonight to talk about prescription drug prices and her legislation on that specific subject. Also here with Joel Foster with Healthcare for America Now, one of the leading organizations working on messaging, communications around the debt ceiling fight. And also Shane Piccinini, who works with the Northern Nevada Food Bank, who's going to share some insight on what's going on with the budget negotiations here in the state. And then, of course, yours truly to give you a broader update on Battleborn Progress's legislative updates from the past week or so. So I'm going to start with Assemblywoman Considine. Assemblywoman, welcome to the show once again. Thank you so much for being with us here. I wanted to talk to you about one of your bills specifically, which is AB 250. This is a bill that deals with prescription drug pricing. I wanted to ask you first, tell us about AB 250 and how do you envision this bill fitting into the larger landscape of healthcare policy, both in Nevada and nationwide?
Thank you so much, Will. I am Venicia Considine. I do represent Assembly District 18, which is Southeast Las Vegas, and I'm so lucky to be able to do that. Even luckier, I've been able to sponsor AB 250. This bill, for me, is about people. Prescription drugs have gone up 500% in the past 30 years. Nevada has some of the highest costs for prescription drugs in the nation. And recently, President Biden passed the Inflation Reduction Act, and the Inflation Reduction Act has a portion in it where Medicare is now able to negotiate with pharmaceutical manufacturers to come up with maximum fair prices for certain drugs. So the way that that works is the sort of the big dogs in the country, pharmaceutical companies and Medicare, they get together, they pick the top 10 drugs for the Medicare population. So those would be drugs for blood clots, for diabetes, for stroke, for some of the biggest issues that we have. And the drugs that they're focusing on are the highest cost drugs and the highest need drugs. So the way that this works is in September, they will announce the first 10 drugs. The next September, they will announce the cost, the maximum fair price for those drugs. And then that goes into effect on January 2026. So what that means is once they've determined the maximum fair price, that is the maximum fair price for anyone on Medicare. What AB 250 does is it says, well, why is it only fair for a 66-year-old to get life-saving cancer drugs, but not a 59-year-old? Or for a grandfather to be able to pay that maximum fair price, but a grandson with that same life-altering disease has to pay something, outside of potentially even their insurance coverage. So that gives every Nevadan the same maximum fair price for those drugs, whether you're 14, whether you're 59, whether you're 66. And what is great about that is this is only the beginning. So this year, when they pick those 10 drugs, when those prices go into effect in 2026, the year after that, there'll be 15 more. The year after that, there'll be 15 more. And finally, in the year after that, there'll be 10 more. All of these drugs have been on the market for at least 7 years, more like 10, 12 years, without any competition. So these drugs have been on TV, they've been marketed, they've been making money, but there's no generic alternative. These are all patent drugs. But now when you are facing, I kind of have a list of some of the drugs that we think they'll be: blood clots, anti-diabetic, leukemia, lymphoma, rheumatoid arthritis, asthma, breast cancer, prostate cancer. If you have one of those diseases and your doctor prescribes you one of these top tier drugs, there's a maximum fair price you pay when you buy it, whether it's through your insurance or whether you don't have insurance. That's what you're going to pay at the pharmacy. So it is life-changing, in my opinion, for folks in Nevada to be able to access this. And it brings down the cost of prescription drugs, which is something that needs to happen all across the country. And we're also not the only state that's doing this. We might be the first, but there are other states trying to do this as well. So once you have other states doing this, that can have an effect nationally. EpiPen prices just came down. They've capped insulin at $35. This is a movement, and we are moving along with it.
Yeah, thank you for that. And you touched on there some of the types of drugs that this might cover for really common ailments. Can you tell me a little bit about maybe approximately what the estimated savings might be for people who use some of these drugs that you listed to continue on and live a healthy life?
So those will be negotiated. So we don't really know what those maximum fair prices are. But right now, if your doctor has prescribed you a drug that is $1,000 for a shot or $400, for 30 days, if that comes down to $150 or $200, first, it's more affordable and you're not cutting your pills in half. You're not, when you're figuring out, I need to pay my rent, I need to pay for food, I need to pay for childcare, this amount will make a difference. More importantly, if your insurance doesn't cover it, the price is low enough that the insurance does cover it. It could have even a bigger benefit. So in our bill, AB 250, the maximum fair price is the maximum fair price for that drug. But if your insurance has negotiated a lower price, you get that lower price. This is just the ceiling. So there could be even, a lower price if that happens. So we won't know for sure until those are finally negotiated. But it is still going to be lower than what people are paying now, or even make it affordable when it's completely unaffordable now.
Yeah, and I also want to encourage folks, because we've worked on this issue of lowering prescription drug costs a lot with our folks, our partners at HCAN and others. And we are always stunned by the stories that we hear of, like, events we do of people who have to ration their medicine that they need in order to survive, cutting pills in half, like you said. And I encourage folks, again, if you have questions for the Assemblywoman on how this bill would work, please drop those in the chat, and please share this with your friends who might be interested, because we want to make sure they have the information too. So my next question for you, Assemblywoman, is during the hearing we had on this bill a little while back, the first committee hearing, you talked about this, you made a metaphor of this being like King Kong versus Godzilla, and this legislation goes up against some powerful interests, big pharma, right? In the hearing, we saw person after person talking about their experiences, rationing, choosing between prescriptions and rent. How do you navigate as a public official the listening to those voices of, the lobbying groups, the quote unquote experts, and the folks who are simply just trying to afford their medicine, the everyday folks who come to testify at these hearings?
Well, so when I'm not in the legislature, when I'm in my community, when I'm talking to folks, I've been hearing these stories for decades. I'm sure we all have. And when you're hearing somebody who has worked their whole life And for example, I talk about a 59-year-old woman who had worked her whole life and was working to have insurance and then got uterine cancer. And because she got uterine cancer and because it took so long to be diagnosed, she had kept taking time off from work because she couldn't work because of everything she was going through. And then when she was going through chemo, again, she had to take all these chunks of time off from work. And because she couldn't work, she ended up losing her job. She's worked her whole life. Now she's got no insurance. She's not old enough to get Medicare, yet so she's got to sort of hold off on that. Those stories stick with me because this is why we're here. This is what I want to help is I want to help people in that situation. And then that metaphor of King Kong and Godzilla that, I mentioned during the hearing is because when you're talking to folks that are representing the pharmaceutical companies or the insurers or the PBMs, they're very much like pointing fingers. Well, we can't do it because of this, or this what's happened here, or here's the real problem, or here's the real issue. And it's really hard to sort of drill down. And what I sort of just saw in that is you have these big companies that are fighting each other for this part of the market, that part of the market, this profit. But what is happening is while they are doing all of that, people are dying. They're getting trampled. They're losing their lives. They're just trying to live their lives every day while this big fight goes on that isn't making a change in their daily life. So that's why we are fighting to lower prescription drugs. That's why this amazing thing that came through the Inflation Reduction Act, that's why we brought this bill. This is not an opportunity that comes around all the time. When the big guys are fighting each other over it and you can't get in a word, the Inflation Reduction Act sort of jumped through all of that. They were just like, nope, you've got to negotiate. You negotiate with each other. You come up with a price, and that's what happens. And this bill piggybacks off of that because we sort of jump over all of those fights and say, you've already agreed to these prices. And if you've already agreed to these prices, why can't every Nevadan have it if they need it? If you're going to do it for the 500,000 Medicare people we have in Nevada, why not the others that suffer the same thing, but for their birth date, they can't access it or afford it? This cuts through all of that.
Yeah. And I want to also then kind of take this now a little bit back into the federal level. Obviously, AB 250 is connected to that, and then it plays off of the Inflation Reduction Act and the negotiation of drug prices in that bill. I'm curious to know then, how do you see those kind of federal initiatives working in tandem with the state, particularly with this legislation, assuming it gets passed, but also things like our public option that we're working on implementing and things of that nature? Can you give us a perspective of how the state and the federal government here can really benefit each other to just improve healthcare outcomes for all communities here in Nevada?
I think that when both sides are attacking an issue, and the issue is in the middle, that maybe this is how we can come together and figure it out. When you've got the federal government has the great things that they can do, and the states can start sort of standing up and saying, well, what can we do? And if the states can do a little bit and the federal government can do a little bit, and we can meet in the middle, and what's in the middle are the people and the people getting relief. That is what my goal is for all of this. And this is what I hope happens across the country, is that we start attacking the issue of high prescription costs and healthcare overall, bit by bit. And eventually it just becomes sort of a snowball on both sides. And then we have affordable, truly accessible healthcare for everyone in this nation.
Very good. Thank you so much again. I did have a question from the chat for you, which is, what are the next steps on this legislation, specifically AB 250, and how can folks get involved in supporting this if they choose to do so?
Well, thank you very much. So it just passed the assembly. So it passed like however many times it needs to. Like it became a BDR. It got a hearing. The committee voted it out. It went to the floor. It came out of the assembly. Now all bills have to go to the other house and go through the same process. So now it goes to the Senate. I believe it's going to be heard in Senate Commerce and Labor. So we have to get the hearing scheduled. Then we have the hearing. There's always support testimony. If you're in Carson City, or you can get to Carson City and you want to testify in person, great. If you're able to do it online or on the phone, great. If you want to tell your story and you don't want to, you're not available, you're at work, anything, you can email it. You can email it to me. You can email it to the Senate Commerce and Labor. You can go online on the Nevada legislative website and you can put your opinion in. You can also call your own representatives, your state senator, your state assembly person. You can contact everyone on the Senate Commerce and Labor. You just making your voice heard matters, because up here, in Carson City, when we're sort of all in this thing for 120 days, the people that are here consistently are the people who are the government affairs people, the lobbyists, and us. The elected folks. So having your voice, however you can get it here, makes a huge difference, because that's why we're here. Any of those ways to do it would be fantastic. And also never underestimate making a phone call.
Absolutely. Yeah. And it really sometimes is that simple. And the great thing about the legislature now is you can testify by phone. So even if you can't make it up to Carson City, you can't make it to Grant Sawyer in Las Vegas, you could always testify by phone. We here at Nevada One Progress, if you follow along with us, are always putting around action alerts that give you the exact directions on how to do that. And so we're going to be watching for hearing on the Senate side for this bill sometime in the next several weeks, and we'll be letting folks know how they can participate then. Last question for you, Assemblywoman, I'll bring in some of our other guests, is what do you see maybe beyond AB 250 to help lower costs for healthcare costs, specifically for consumers, addressing things like copays or premiums? Have you thought about other ways the state can help lower those costs as well?
Well, I'm sure there are other ways. I know there's a lot of folks talking about them. I don't know anything specific. My next thing is to tackle PBMs and how some other states are doing it. And again, to kind of keep trying to I don't want to say bite around the outside, because that's not the right thing, but to find all of these knots and try to work them out in small chunks, because the small chunks will add up. So that's sort of the next thing. But right now it's getting AB 250 through the Senate, and then through, the entire legislature, and then get the governor's signature. And then we just keep going more and more steps.
Excellent. Well, thank you so much, Assemblywoman. You can stick around with us if you'd like. I'm going to bring in actually our next guest, which is Joel Foster, Healthcare for America Now. And so welcome, Joel, if you'd like to introduce yourself. And my first question for you is, what's going on with the federal debt ceiling debate? And tell us about what happened yesterday and how that will impact healthcare access for Americans going forward.
Well, thanks for the question, Will, and thanks for having me on again. And you have such great legislators in Nevada. You have a long history of great legislators. Clearly, Assemblywoman Considine is another example of amazing legislators in Nevada. You are so lucky to have such talent. So I want to say that. I am the Deputy Executive Director of Healthcare for America Now. We have obviously partnered with Battleborn Progress for years now. You're such a great organization, and we value so much the work that you do in Nevada for Nevadans. Well, let me actually start talking about the debt ceiling by talking about 2017, because that's really where this story begins. So if you remember, the first thing that the then President Trump and the Republican Congress did really when they took power was pass a massive tax cut for the wealthy. Massive tax cut for the wealthy. We're talking about $1.9 trillion over the course of 10 years. Permanent cut to the corporate income tax. Very large temporary cut to personal income taxes that are set to expire in 2025. And many Republicans want to extend those permanently. And the vast majority of those cuts, right, more than half of those cuts went to the wealthiest 5% of people in the country. The wealthiest 1% of people in the country got about a $200,000 a year tax cut. So the debt ceiling, this debt ceiling fight starts there. So, during the rest of the Trump presidency, Republicans were falling over themselves to raise the debt ceiling. They were voting for it all the time. And then when President Biden comes in and actually starts doing things for working people, all of a sudden the debt ceiling is a problem. And so yesterday, Kevin McCarthy forced through what would increase the debt ceiling, but he added a ton of conditions to it, right? And I want to go into those a little bit, but this package is awful if you care about healthcare, but it's also awful if you care about climate, if you care about economic justice, if you care about equity. It's awful on a whole host of levels. I'm just going to talk about healthcare for a little bit, but it's awful on a number of levels, on a number of issues. So I want to stress that. On healthcare, this package would cap spending and reduce spending by $1.47 trillion, right? That's a $131 billion cut from where we are right now. So it would reduce spending by $131 billion a year from where we are right now. They haven't detailed the cuts. We know that those are going to come out of healthcare and education and many of the other programs that we care about. They're probably going to come out of some of the environmental protections from the IRA that were passed last year. But then the package caps the increase in spending so that we wouldn't actually be able to make up that $131 billion cut for another 10 years. So we would actually be reduced spending for a decade over the course of 10 years. So that's bad in and of itself, because that would mean permanent cuts basically over a decade to all the programs we care about. But in addition to that, they're actually forcing through one of their longtime conservative priorities, which is they want to create work requirements for a number of federal programs, including Medicaid. They also included provisions for work requirements for SNAP, right? The Supplemental Nutrition Assistance Program, kind of formerly known as food stamps, and TANF, Temporary Assistance for Needy Families. What we know about work requirements is they don't work. They don't encourage people to work. And in fact, they actually reduce benefits for working people, because what they're really designed to do is kick people off of programs that they really need. That's what they're really designed to do. They wrap it up in language around work and all of this stuff, but we know from the states that actually were allowed to do it under Trump, like Arkansas, that a whole host of people that are working and actually do meet the requirements are kicked off the programs anyway, because they create these administrative burdens that are so difficult. Because you have to go onto a computer system and resubmit your credentials over and over and over again to meet these requirements. Otherwise, you lose benefits. And in Arkansas, we're talking about 18,000 people that lost benefits in a small state like Arkansas, just from their Medicaid requirements, work requirements. Now imagine what that would look like nationwide. So that's just one of the terrible provisions. There are a ton of terrible provisions in this package that was passed yesterday. And the Republicans that voted against it because it wasn't draconian enough, right? Like the 4 Republican votes they lost said it's not terrible enough. We need to make it worse. It's just a terrible package. And thank goodness we've got some people in the Senate that are never going to agree to this. President Biden said it's a non-starter. He would veto this right away. So we've got some leadership, but we've got to do some work, explaining how terrible this is and how terrible the Republicans' votes on this are.
Yeah, and that's really where our kind of next step comes in, right? Is to make sure that people understand just what's happening at the federal level and why this is incredibly messed up and can potentially impact people back here at home. I'm wondering, is there anything, of course, Biden has put forth his counter proposal to challenge this, and are there any provisions related to healthcare equity that you think should be prioritized in legislation related to the federal debt ceiling? Is there a way to counter this in a way that's smart, that protects the progress we've made, that prevents some of these damaging cuts that are happening?
That's a really good question. We have to get work requirements out of this stuff. We cannot negotiate away equity, and that's what this is. That's what work requirements are in Medicaid, in TANF, in SNAP. Right? These are programs that disproportionately aid working families, disproportionately aid Black families, Latino families. Right? And so when you institute work requirements and onerous administrative burdens, which is what they are, you're disproportionately harming people and making the system even more inequitable than it is. And so this is a direct attack on working families, particularly working families of color. That's what it is that the Republicans have launched yesterday. And so we need to make it clear that any administrative burden that attacks working families, particularly working families of color, is a non-starter. And we have to tell the story about exactly what this is intended to do, which is deny people access to the benefits that they need, and the benefits that they qualify for. This is simply, wrapped up in some sort of fake language around work. And what it really does is it's a cut. It's a cut to programs that people need. And by the way, their package also cuts benefits for veterans, right? It just is a continued attempt to deny the ability of people to benefit from government efforts to create a more equitable society. That's what it is, and we need to push back against it.
Yeah, absolutely. And I'll say for me, I'm a big Jon Stewart fan. I saw him pointing out the hypocrisy on veterans issues. I know he's been very vocal about that for a long time, and it's unconscionable. You have these people out here saying support the troops, and then meanwhile are cutting benefits for veterans. Just doesn't make any sense at all, and it's extremely screwed up. And then the thing with work requirements is like people have access to these programs a lot of the time because they are working, but it's also like you create these hoops that people have to jump through, and it's all designed at kicking people off and excluding people from the program. So I wanted to then kind of ask, in light of the discussion we just had with the Assemblywoman on like state level efforts that we're doing to create some healthcare equity, lower costs for families and such, and actually building on specifically something that the Biden administration passed. What do you see as maybe at the state level ways to improve healthcare access? What are your thoughts on that?
It sounds like, and I haven't read the bill that the Assemblywoman was discussing, but it sounds great and exactly what I was going to say, which is the Inflation Reduction Act that President Biden signed into law did some great things, right? It allowed Medicare negotiations, which is going to bring down the cost of prescription drugs. It capped insulin prices, out-of-pocket insulin prices. What we need to do nationwide, right, is extend many of those provisions to the private market, right? Which Congress tried to do, right? We tried to do that, and Republicans voted against it. And so, we need to bring down the cost of prescription drugs at the federal level. If we can't do it at the federal level, we need to figure out ways to do it at the state level. So it sounds like you're having those discussions in Nevada. There are other states having those discussions. It sounds like exactly where we need to be going with prescription drug prices, which is figuring out a way to lower them for everybody, right? Not just a few people here and there. It's important that obviously Medicare beneficiaries will benefit from the negotiations. We need to extend that to the private market and to other places and bring down prescription drug costs for everybody.
Yeah, and to put it, and I'm sorry to go off script a little bit here, but Can you kind of just, in a nutshell, explain like why it was such a huge deal with the Inflation Reduction Act to introduce price negotiation for prescription drugs and these other caps on insulin and things like that, that, you know, now we in Nevada are able to take that and run with it to do our own legislation? Can you
Absolutely.
put that in perspective?
Yeah, no, absolutely. So, as you know well, and the Assembly woman knows, and many other people know, Medicare has not been able to negotiate drug prices, right? It was actually a provision in law that said specifically Medicare cannot do this, and because there are so many people in Medicare and so many people that purchase their prescription drugs through Medicare, when you allow prescription drug prices to be negotiated in Medicare, even if they're not extended to the private market, there still is this deflationary pressure, because it kind of forces the cost of prices down. But not as much as we would reduce the costs if we allowed the negotiations to operate and be extended to the private market in the way that we tried to attempt, that we forced a vote on the Republicans blocked, right? So, huge historic thing that President Biden and the Democrats in Congress did, and we need to go further, right? We cannot stop at this point. We need to go further. It doesn't appear like there are enough votes in the Senate or the House to do that in the current incarnation of Congress, but we need to be talking about it. We need to be pushing people to do it, whether they're Republicans or Democrats. I personally think we should be forcing votes on it as much as we can. But in the meantime, people cannot wait for the federal government to enact change. So where and when at the state level that we can do it, we should be doing it and pushing it forward.
Excellent. And Assemblywoman Considine, you're nodding your head. I maybe wanted to bring you in and just ask, maybe, do you want to comment on that and how you were inspired with this legislation, specifically on 250, by what the Biden administration was done?
Well, yes, and I agree with everything. And I think, as was mentioned earlier, it's opportunities like this that we need to harness, we need to jump on, we need to, take further. But one of the things that I did fail to mention is that our Senator, Catherine Cortez Masto, and I believe Amy Klobuchar, another one, they actually introduced an act, or introduced a bill called SMART. Sorry, I had it written down. The Strengthening Medicare and Reducing Taxpayer Prices Act. So the SMART Prices Act, that would make this process happen a year faster. So to Mr. Foster's point, pushing this further, bringing this up for more votes, coming at it from both sides, it's happening. And as more people get more excited about it, as more people see the opportunities and we move towards this, I'm just excited and wanted to make sure that we know that you knew that there was further movement in the Senate and by our own Nevada senator as well.
Absolutely. Thank you so much. I neglected to mention that. I'm so glad you brought it up. Both of your U.S. senators, Senator Cortez Masto and Senator Rosen, have been great champions on this issue, as you all well know. And most of your House delegation, I'll let you guess, which member of your House delegation is not as supportive. But you just have some great champions on the federal level. And obviously, if we had more champions like that in every state, we'd be a lot better off than we are.
Hey, 3 out of 4 is pretty good still. We're 75%. Awesome. And so I have 2 more questions from the chat for you, Joel. And then one of them actually I think is going to be a good segue to our third guest of the evening. So actually the first one I'm going to ask you is, what can what can just everyday Nevadans, people around the country do to make their voices heard at the federal level to weigh in on this debt ceiling debate as it plays out over the next few days and weeks?
That's a really good point, because literally almost every state, people in almost every state have a role to play in this. Because if you look at the vote yesterday, 217 members of Congress, all Republicans, voted for this terrible package. 215, mostly Democrats and a few Republicans that voted against it because they didn't think it was terrible enough, right? But 217 to 215 had a single vote gone the other way, had one more Republican voted the wrong way, they would not have been able to pass this terrible thing. So in Nevada, you've got somebody that voted for this thing that needs to hear about how terrible it was over and over and over again. And because he was a deciding vote. He was literally the deciding vote. And so we need, Nevadans need to let him know that instituting onerous benefits for people, removing climate provisions, attacking veterans, and forcing massive reductions in programs is not where we need to be right now, and not what we need to be doing, and not what's good for Nevadans. That I think at the federal level is the number one thing. And just to support those people that voted the correct way, to support working Nevadans and let them know, thank you for those votes. And, to support your senators in the fight that's going to come at the Senate level, right? I think those are the most important things moving forward.
Excellent. And then my last question for you, and then we'll bring in Shane, is, and this will actually kind of tie in a little bit and tee up Shane a little bit, which is specifically, how will the debt ceiling impact programs like SNAP? We know SNAP's like one of the most efficient, best federal programs that's out there, feeds people quite literally. What are we looking at? Because we already saw with the pandemic benefits expiring, some people losing access. If the cuts that McCarthy is trying to force through go through, what's the scale of how SNAP and WIC and those kind of programs could be affected by this?
It's a good question. So we don't know the full extent. Because it's not a budget, right? They don't have to detail exactly what the cuts would be from the amount that they're reducing spending. So the cuts to SNAP itself could be draconian. We expect them to be, but they're not detailed. But what is detailed about SNAP are the work requirements, right? And they are significant in terms of the increase in the people that would be required to deal with the work requirements in both SNAP and TANF. So we're getting some indications, but we're talking about thousands upon thousands of people that could be negatively impacted, be kicked off assistance, and with the SNAP and the TANF requirements, I think I'll have to double check, but I believe it would also apply to people with kids older than 7, right? So the Medicaid work requirements that they're trying to institute, people with dependent children wouldn't have to abide by the work requirements in Medicaid. But I believe the SNAP and the TANF provisions would apply if you have kids over the age of 7. So we're talking about families with kids that would then lose food assistance. I'll double check on that while Shane is talking. In fact, Shane, on cue, Shane put something in the chat, and apparently,
Shane, if you want to actually hop on and address that would be great. You're muted.
Sorry about that. Sure. So the work requirements for TANF and SNAP would adversely impact families with kids over age 7, right? Kids that are what we now call school age. Also, the work requirements extend the age from 18 to 49 to 18 to 59, something like that. It adds like 10 years of additional requirement to the provisions. So these things are, just horrible in a lot of ways. And when you're dealing with a tourism-based economy such as Nevada, where we've got ski instructors that are also backcountry guides or river guides who depend on SNAP for those between seasons. When you have an epic snowpack where it could be a while before you can put a raft in the water, you're going to be looking at a lot of seasonal employees that are going to be denied access to these programs under these new rules.
Thank you for that, Shane, and welcome to the program. I was going to bring you next anyway to talk about pretty much this subject. But Shane Piccinini, you're with the Northern Nevada Food Bank. Can you describe some of the programs and services that you primarily work on, and also what you're working on specifically at the legislature right now in relation to that?
Well, we just like Three Square down in Southern Nevada, we operate all of the federal nutrition programs. So we've got the Senior Commodities Program, we've got the Temporary Emergency Food Assistance Program, which gives emergency food to people who need it right now, along with we also collect donated food, and we do buy some food to distribute through our 150 partner agencies. And then we also are a trusted partner with the Division of Welfare and Supportive Services to do SNAP outreach. So we have got a wide range of assistance that's available for individuals and families to seek food assistance. This legislative session, our big ask for the two food banks is a $4 million appropriation for us to be able to spend $1 million for each food bank over the next biennium to be able to get additional food in our warehouse. And, Joel and others have talked about how the pandemic SNAP benefits, the emergency allotments that the Congress authorized back in 2020 have gone away last month as of March 15th. So families are facing a huge cliff in benefits. Almost everybody on SNAP right now was not on SNAP in 2019, so they have no idea what the pre-pandemic benefit looked like. And then when we add inflationary pressures to the family budget, this is a big deal. This is going to impact a lot of people in ways that we haven't seen since 2007, probably. When the banks were collapsing.
And Shane, can you talk about the types of populations that you engage with? How does the Northern Nevada Food Bank engage with and support specifically vulnerable populations, children, seniors, people experiencing homelessness, and what their food insecurity situation looks like, and just again, what we're looking at in terms of scale with some of the things that are happening at the state and federal level?
The populations that are the most vulnerable that we're working with right now are going to be seniors and people who are experiencing homelessness. Seniors are seeing an economic cliff with their SNAP benefits going from $200 a month down to $20 or $30 a month. People experiencing homelessness, a majority of those are going to, at some point, although Nevada currently has an exemption from the work requirements that will go until the end of 2024, at some point, those work requirements are going to come back. And people experiencing homelessness primarily are going to be the ones that are going to be hit hardest by the work requirements that were placed into the law during the welfare reform of the Clinton administration. We work with working families, and we work with school-age children with school pantries. We run the summer food service program, which gives free lunches to kids during the summer when school's out, and we operate the Kids Cafe after school meal program so that kids can get a free dinner after school on their way home. So, we support, the entire community as much as we possibly can. The budget proposals that, Kevin McCarthy and the House Republicans have put forward are really going to complicate this. And I'm not worried about them becoming law. That's not really my thing. But this is what does have me concerned, is that the inability of the speaker to be able to get the votes that are required on September 30th when the government needs to be funded, and then there is a prolonged government shutdown, those are devastating to families. Potentially Social Security checks could stop, certainly SNAP benefits could end for a while. That is the kind of chaos that really causes problems and costs the taxpayers thousands of dollars literally in order to bring the government back up and to make up for what was lost. So, every time the government shuts down, real vulnerable people are just slammed against the wall. And we're really trying hard, to avoid doing this. The other thing I would say just briefly about the work requirements in the bill that passed yesterday in the House is that the message that we are asking people to send out to our congressional delegation is right now we are negotiating the new farm bill. The Congress requires us, or the law requires us, to reauthorize the farm bill every 5 years, and the food stamp program and TANF and a bunch of other things are all wrapped up into the farm bill. So we want to make sure that the programs that are in the farm bill are negotiated in the farm bill. We don't want the Congress separating out pieces of the farm bill and negotiating them separately. That makes it really difficult for us to get comprehensive reform in the farm bill. And so that's our ask to our members of Congress, is keep the farm bill intact and put an end to what the House was trying to do yesterday.
Thank you for that. And it really is unconscionable, but I think you touched on how, it's not even really just even the implementation of the policy itself, because we don't think that's going to happen, but it's the effect that it creates. And so I wanted to also ask you about the federal farm bill too. If you could give us some insight on how that affects food security, because I know SNAP and WIC and those kind of things are often included in the farm bill, deals with a lot of agriculture type things. And that's also part of the negotiation that's happening right now. So can you explain what the federal farm bill is and how that affects the work you're doing in Northern Nevada?
There's two really big food security related programs that are in the Farm Bill. SNAP, which is roughly 80% of the Department of Agriculture's budget. And then the other program is called TFAP, the Temporary Emergency Food Assistance Program. Those are commodities that the federal government negotiates and buys and distributes to food banks across the country. In the Feeding America Food Bank, there's about 200 members, but they're not every food bank is a Feeding America food bank. So the Temporary Emergency Food Assistance Program is designed to be the frontline stopgap to make sure that people have access to good quality food. The farm bill that we are asking for right now is to maintain the existing funding level and then increase the amount of money for bonus TFAP, meaning excess product that the Department of Agriculture is able to get through the supply chain, and then additional administrative money so that the food banks who administer the program can continue to keep up with the escalating cost it takes to operate the program. So I want to make one thing really clear, and this is true for 3 Square too. We get the commodities from the USDA through a grant that is issued through Congress, and then it's administered through the Nevada Department of Agriculture. We get the food. What we don't get is the support that is required to then take the food from the warehouse and get it out into the communities. And, the food banks are as much of a logistics operation as we are a social service agency, right? So we have, a fleet of 53-foot tractor trailers that we have to maintain in order to get the food out into the community. And the Food Bank of Northern Nevada's got a 90,000 square mile service area. We're in every county except for the 4 southern ones. And then we've got 10 Sierra California counties. So, it's really complicated and it's very expensive for us to be able to do what we do to meet the need. And right now we're serving around 130,000 people, which is the highest it's ever been.
That's excellent. And I had a question for you from the chat, which is, how do people get involved if they're in Northern Nevada, in the Reno, Carson area, or just anywhere in Northern Nevada? How do they get involved in helping out with your program or other food assistance up north?
Anybody who would like to get involved with either with that or us or 3 Square in Southern Nevada, if you go to the respective websites, fbn.org or 3square.org, there is a Get Involved tab that you can check, and there's a ton of volunteer opportunities. One of the biggest things that we obviously need is people that's willing to come in and sort the food or help distribute the food at one of our direct service operations that we have, like Mobile Harvest. So there are plenty of opportunities for people to be involved. But the single biggest thing that people could do right now is literally write your member of Congress, Susie Lee, Dina Titus, Mark Amade, Stephen Horsford, all of them, and just make it very clear that we want the farm bill to stay intact. That's my need right now.
Yeah, so make sure you are contacting your Congress member today.
Yep.
We posted, I believe, on our social media comments that Congressman Horsford was making yesterday in regards.
Oh yeah, he had some great comments yesterday for sure.
Yeah, Congressman Horsford did a big remarks about it, so you could check that out on our Twitter feed. I'm gonna go. So unfortunately, Assemblywoman Considine had to jump. We're up at the top of the hour. I'm gonna do just a quick last plug for anything y'all want to share. And I will close it out with a little NV Ledge update. But I'll start actually with you, Shane. Anything else on your work that you want the viewers at home to know about, or how they can take action, or what they should be watching or paying attention to that you'd like to get some attention on?
I would love it if people would be willing to go to the Nevada Legislature website and place some positive comments for SB 341, which is our food appropriations bill. We're waiting for Economic Forum on Monday to decide how much money the legislature is going to be able to spend. And then, of course, they're going to allocate that. And we really want to make sure that we get the full $4 million. So the more nice things that are said about SB 341, the better off we're all going to be.
Very good. And then thank you for that, Shane, and thank you for coming on. Joel, want to give you the last word on anything you want to plug on the work that HCAN is doing.
Yeah, I would just say support your elected officials in Nevada. Most of them are doing such great work, and they need to hear some thanks when they do good work. So often we're motivated to let people that vote the wrong way know how we feel, and often forget to let people know that we appreciate how they're voting if they're voting the right way. So you've got some great elected officials, obviously at the state level, we heard tonight, but also at the federal level. And I would just say, when they do the right thing, say thank you, because it really does make a difference.
Yeah, I want to second that because, again, elected officials, they're trying to get reelected. And so as sometimes a little bit cheeseball as you might think it is, it actually does go a long way to recognize when they do good work and when they stand up for the people and do the right thing. So I can't stress enough. It's why we do it here at Battleborn Progress. It's why we encourage other folks to do it, because it really does make a difference, and it pushes back against the narratives that come from the right that want people to, the reactionary sentiment that always put out against these things. So thanking your elected officials when they do the good things is really, really important. All right. Well, thank you so much, Joel. I am going to finish up just with a quick legislative update, so don't go anywhere, or you both may if you want. But for the folks at home, we are through the first House passage deadline in the Nevada legislature. So what that means is the day where all of the bills that were voted out of committee on the House that they were introduced in, they then had to be moved out of the out of the floor of the House they were introduced in. So if you had a bill in the Assembly, heard in the committee in the Assembly, gets passed out of the Assembly committee, then the whole Assembly has to vote on it. Now what happens is all those bills that got voted and passed, they all go now to the opposite House that they were from what they were introduced in. So if it was an Assembly bill, now it's in the Senate. The Senate is now going to hear those bills just like they did on the Assembly side. They're going to go through the exact same process again. They're going to hear the bill, vote it out of committee, and then vote it out onto the floor. So everything just happens again twice, except all the bills are flipped. So if you're watching a Senate committee, you'll see Assembly bills. If you're watching a Assembly committee, you'll see Senate bills and vice versa. There's also bills that have been exempt from deadlines. Those are ones that affect the state budget. So we're watching a great deal of those as well, because those have their own deadline at the very end of the session so that we can adjourn, sine die on the 120 days on time with a balanced budget that hopefully includes some very good things for Nevada's working families. I did want to note that last night we had two very large hearings that some of you may have been late with us watching. Those were for Governor Lombardo's bills, SB 431, So the first one, it says government restructuring, reorganization, modernization, whatever you want to call it, bill. It's none of that. It's a power grab. It's a consolidation of power to the executive branch. It does things like gut the authority of the interim finance committee to review certain decisions that the governor can make. It also is problematic in that it creates something called the Nevada Way account, which is sort of this nebulous slush fund in the state budget that is basically governed by a committee that is run by, guess who, the governor, and is able to award money to all sorts of entities or agencies in the state that will allegedly help with economic development or things like that. But there's a lack of accountability, a lack of transparency, a lack of checks and balances. So we testified in opposition on that yesterday. You can see on our social media all the happenings as they happened. Special shout out to Senator Skip Daly, who asked some really great questions in that hearing yesterday. The second bill was heard in Assembly Ways and Means. That's AB 400. That is the governor's school privatization, pro-school voucher bill, which, of course, we have been fighting against every session here at Battleborn Progress, this effort to defund our public schools and send that money to private out-of-state institutions. We testified in opposition to that. There were lots of educators and parents and families who joined us in doing that as well. And again, you can check our social media for the play-by-play of that, and you can see our statement on the events from last night posted on our webpage as well. Encourage you all to share that and take a look. We are currently also just getting ready for if there's a hearing held on the governor's crime bill, which contains a lot of very troubling language as well, and also his bill to curtail mail ballots and require voter ID, something that we're also very opposed to. Those are not scheduled for hearings yet, but they could be at any point. So we're going to be ready, and we encourage you all to follow along with us here at Battleborn Progress for the latest action alerts and emails and social media to respond in kind when those things are brought up. It's going to be very important because we want to make sure that the governor, this new governor, understands that Nevadans are not in support of this Joe's way, not the Nevada way, which is what we've been calling it. He likes to insist that his agenda is called the Nevada way, but it's actually Joe's way because it's all about aggrandizing himself and his own power and those of his appointees. And we're saying, no, that's not right. So please stay tuned with us here. Thank you all so much for joining us tonight. It was a great program. I hope you enjoyed it. Please share with your friends and join us next week on Thursday again for Out in Front. Thanks, everybody, and have a good evening.